Baltimore County, close to the city, but also in the heart of Dundalk and close to Essex. That is our primary area that we serve, is the southeast side of Baltimore County. And I'd love to have you here. We're located at 7822 Eastern Avenue, and that's Baltimore, Maryland, 21224. So this is the outside of our office, but I'd love to take you on a tour on how to get in from the back. So as we come down around here, you'll notice our driveway with our signage over here that lets you know you made it. And as we come around back, there's plenty of parking, but I'm going to show you some do's and don'ts, so that way when you get here, you feel most confident in where you've parked, okay? So as we come around the back side of the parking lot, you'll notice that we have a couple vehicles over here. The van is parked in a way that, while convenient, is going to block some people in. So we'd prefer that you not do that. But as you take a look at the white Jeep, that's where we'd love you to park. And if not, even further down and on a diagonal, so there's enough space for everybody to get in and out as they come in for services. All right, so as you come around the back side, you'll also notice that there's a couple entrances. So this back door is for staff only, but as you come around, clients will most often come in through the ramp. And as you're leaving the parking lot, you'll notice that there's another driveway for exit onto the main street. Now we're located also off of Eastern Avenue, and it's really close to bus lines. It's really accessible from 95 and 695. So if you're looking to come visit us, please do. We'd love to see you. We're so excited. I'd love to show you inside. As you come up the ramp, you'll notice that it is handicap accessible. If you're having difficulty walking, there are also handrails. And it's also wide enough for a stroller if you are bringing little ones with you. So as we come up the top of the ramp, what you'll notice is we're coming up to a door. On that door, you'll notice our hours. Please just come on inside. You shut the door, you'll also notice that there's signage for our hours of operation, ways to connect with us, and then if there's any office changes to the hours for like holidays or breaks or any emergencies that come up, post it right here. There is also a posting for emergency service contacts here on the wall. You know, if you can call into the office, they'll also be able to provide you the same crisis information as well. There's Wi-Fi password information here, so that way you can be connected while you're waiting. And there's also any new offerings listed right here as well. Like this is an example of our med management. Okay. As you come into the waiting area, you obviously notice some seating. You'll also notice a table and chairs for the little ones if they need to be coloring or distracted. There's some toys on the floor, and then there's also some books in the back as well. To the center of the wall, you'll notice community events, community resources, anything that's going to keep us kind of connected within the Baltimore County Southeast Network. We'll have posted there. And on the far door, what you'll notice is group offerings that we're having for our current session. So as you come around and you're called back, one of the things that you'll notice is our front desk. So as you come in, you'll see our front staff. They'll usually greet you with a smile, ready to take and help you in any way that they can. They will usually let you know to take a seat, and they'll let the provider know that you're here to meet them. If you need so, you can also utilize the water cooler. If you need to pick me up, there's a coffee machine and some snacks as well. On this main level, there are 4 offices and a restroom. So as we take a look and we come down the hallway, you'll see some of that, okay? So just to give you a little bit more insight into it, we're gonna start from the far, offices and bathroom, and work our way forward, okay? So as we come around, you'll notice that we have an office and another entryway, and then also our bathroom, okay? Our bathroom is handicap accessible. It's also filled with a diaper changing station if you would need that service as well. This exit is usually for our providers. It's not for clients, just because they're walking past other services at that point. And to your left, my right, is going to be our first office. Most offices are set up the same way, but as you take a look inside, you'll notice some decorations, a whiteboard, a desk. Most offices also have a desktop computer for your use if you are here. There are board games because each office is set up for play therapy as well, noting that we service clients from across the lifespan, and those kiddos need a little bit something more to keep them attained in therapy, okay? As we take a look and we come down, one thing that you'll notice is our office layout. If
I could get this for you. You'll also notice where office signage is. So if you come in and you're not sure what office you're going to be working in that evening, you can always take a look right here and we'll have your initials highlighted into which office. If you're confused about the layout, there's also a layout right here, right beside our printer, so that way it's easy access for you to look at if you need a reminder. Okay, so as we come down and we look at our second office, you'll notice that this one's set up just a little bit differently, but also fairly similar, with a whiteboard, play therapy tools, a desk and a desktop computer for your clients' needs, and some comfortable seating. One thing that you'll also notice on our office doors is that if the door is shut, there's a little tab to let you know sessions in progress or welcome and please knock. Okay, so most of the time if it's there, please don't disturb. If you can, if it says please knock, go ahead and do so. The room might actually be empty. We might just be cleaning it out. All right, so take a look over here to our third office. You will notice that there's, again, a desk and a desktop. There's some comfortable seating. There are games and toys over underneath the left side. And there's also a whiteboard behind the door because the doors are closed for services. What you may hear when you come in, because it's kind of quiet today, is a noise machine. So if you do hear something funny that sounds like trickling water, no worries. It's our noise machine. If it keeps going after we turn it off, then let us know. All right. So in here and behind this door is where we keep our supplies for maybe community events, maybe some additional play therapy. Our kinetic sand's in there. We don't want that loose, right? We also have some toys, some dolls, some additional games, but for the most part, there's other community events and files. So we do keep this door shut as we are in the office. To your right, my left, is going to be my office. That is, again, also filled with supplies for you to be able to use for play therapy, as well as a desk and a desktop computer. The only change is that it doesn't have a whiteboard in there. Okay. As we come around and we're looking to our right and my left, this door leads down to the basement. Right now, we don't have any services being conducted down there, and so that's really just for storage and keeping supplies. So you shouldn't need to go down there. Okay. So as we come back up towards the front desk, and you start to notice the main lobby again, we're going to take a left and we're going to go up the stairs and we're going to introduce you to the second level. So as we come around, you'll notice our offices. So our first office that we're going to walk into and take a gander of is Miss Amanda's office. Miss Amanda, who you guys will meet a little bit later, is our medical director and one of our nurse practitioners that work with us here. This is her office and her furniture as she has set up for clients, meetings, and such. Okay. Again, as we come around to my right, your left, we're going to meet Miss Stacy's office, which is filled with seating, a desk, and a desktop computer. Miss Stacy is also another nurse practitioner that is working with us as a part of our med management team. As we look around to the side, here is our front desk. Miss Brittany is usually sitting up here. And so if you do see a head pop up, it's usually hers, okay? And as we come down, you'll notice there's a bathroom on the right for any needs that you have, okay? And as you come around the front desk, this is our kitchen. You can come in here. We have a microwave, we have another coffee maker, we have a toaster, we have plates and silverware behind me in this cabinet, usually snacks down here in these, and then our refrigerator. And as you come a little bit further into the kitchen, one thing that you'll notice is our dining table. So just taking a quick break, maybe you want to eat up here instead of in your office. And you'll also notice signage for our labor laws. And if there's any job postings, you'll also notice them over here, as well as our emergency contact services. So each level has that just for easy accessibility. And one of the last things that I will show you is our group room. Our group room has been used for some of our kiddos at this point in time. So this may look this way today, but may be configured differently if we're running groups that evening. We are getting supplies in so that way we can set it up for more seating and be accessible to the kids instead of having them being jumping jelly beans. One of the other things that you'll notice is our bookcases. Both sides are filled with books. They're for your benefit. you can use them if you want to use them. They're usually previous trainings that we've attended or books from school that we've done. And so there are some DSM-5s up here that you can take a look at. There's also some training materials from other certifications that we've completed. And in the far closet, there is also art supplies for those little ones that may need to do some expressive therapy. Okay, so we look forward to having you come into the office. These are our 2 main levels at this time that we're utilizing. If you have any questions, you can always feel free to ask me. But otherwise, I look forward to seeing you come here.
Hi, I'm Dorothy, and I'm the patient care specialist. My role includes how, if you call, I'm your first point of contact. I'll schedule you for an intake therapy appointment. And then from there, I'm also in charge of the referrals. I will call clients to get them scheduled from there too. I'm also in charge of the medical records. And then when the day of the appointment comes, I will make sure all the intake documents are completed and all the demographic information is received. If you attend your appointment in person, I will introduce you and let the therapist know that you have arrived. I look forward to seeing you.
Hi, my name is Brittany. I am the provider relation and billing manager here at Tidemark. I am the direct contact for all of our mental health providers, as well as giving them any support that's needed. I also assist in the onboarding process, as well as any credentialing once you are onboarded. I am also the direct contact for our billing department. I oversee all of our agency billing, anywhere from insurance claim processing down to direct client contact as far as any of their financial needs or concerns. Basically, I oversee all of the billing and I provide any support that's needed to our Tidemark team. If you have any questions or any concerns, please always feel free to contact me.
Hi, my name's Mandy. I'm the office manager here with Tidemark. I also oversee the reception team. Reception does have a very important role here with Tidemark, as we are the first point of contact for most of our clients. We want to make sure that our clients are met with warmth and confident communications and that they get an experience that exceeds their expectations. My other role here at Tidemark is to be of support to the providers and the clients around scheduling and administrative needs. I will be your point of contact for any scheduling needs. And if you do have any questions or need any assistance, please don't hesitate to reach out to me.
Hi there, my name's Amanda Mullins. I'm a primary prescriber and the medical director for Tidemark Intervention Services. So my typical day is spent seeing clients, but I also help work on internal policies that help us maintain compliance for COMAR regulations for our medication management department as a whole. But the role you're most likely to encounter me in is providing guidance and answering questions that may come up about medications and their role in a client's plan of care. So if anything comes up, you have any questions, concerns, feel free to reach out to me, and I look forward to meeting you in the future.
Hi, I'm Nicole Collison. I am the clinic supervisor here. I'm a licensed clinical social worker. I provide supervision hours. We offer group supervision, individual supervision, and one of the things that we focus on here is also being able to help you guys grow in your careers as therapists, as interns, and maybe coming back to us as therapists. So if you have any clinical needs, I'm here to help you out with those. If you have any questions, you can always feel free to reach me through my email, my Google number, or also Simple Practice. I'd be happy to touch base with you on any questions that you may have for your clinical cases, or also any clinical questions related to hours and supervision. All right, I look forward to meeting you.